Depression it's tricky and sneaky. And again, we're learning more about depression. We're really starting to understand more about it. But I like to think about depression in terms of changes from baseline. When you're feeling good, you know how many hours a night you need to sleep to feel well. You know where your appetite normally is, kind of your set weight. And when we're depressed, things start to move from baseline, but it could move either direction. So classically in melancholic depression, we see that you sleep less. You're maybe having those early morning awakenings where you wake up at like 3 or 4 and you just can't go back to sleep. But in some other types or variants of depression, maybe you're sleeping way more. So sleep definitely is one of those big things that we look on in depression. Any change in appetite, either increased or decreased, and then changes in weight related to that. Again, focus and concentration. Really paying attention to, are you able to do the things that you need to do? Are you able to stay on task? Can you make decisions, especially as compared to that baseline? One of the other things that changes a lot in depression is the way that we move. We call it psychomotor retardation, where all your motor movements are slowed down. You lose some of the expressiveness in your face. You're just not as reactive. And so maybe you're not moving as much, your arms don't swing as much when you walk, maybe your eye contact isn't great. And so those can all be hallmarks as well. With someone who has a more anxious type of depression, they might have more agitation and feel more fidgety and restless. So again, there are all of these other signs and symptoms besides, I just feel sad. Depression is so much more than just that down feeling. It impacts your whole person.
Feelings of sadness, tearfulness, emptiness, or hopelessness are among the symptoms of depression. Depression, especially in midlife or older adults, can co-occur with other serious medical illnesses such as diabetes, cancer, heart disease, and Parkinson's disease. These conditions are often worse when depression is present.